Hi, it's Jeremy Baker with JTB Internet Marketing, and welcome to this edition of Expert Interviews Live, where I interview experts in their field. My guest today, once again, is Dr. Roy Carlson, Center for Implants, Sedation, and Orthodontic Dentistry, and he is here to talk to us today about periodontal disease and gum grafting procedures. Not such a fun topic, but if there's a procedure along that lines that you're thinking you may need, Dr. Carlson would be a great person to talk to about such a procedure. So welcome once again, Dr. Carlson.
Thank you, Jeremy. Thank you for asking me again to be on your program. Thank you very much.
You're welcome. It's great to have you with us once again. You are always full of knowledge when it comes to these types of things, and I am interested to hear more about the topic today. So before we get started, like we usually do, let's just give our viewers a brief general overview of your dental practice. For those that don't know, Dr. Carlson is in Edmonds, Washington. He can be reached at 425-775-2521. He's across the street from Swedish Edmonds, and has been there for many years and has many years of practice. And so why don't you go ahead and give us a general overview of your dental practice first.
Thank you, Jeremy. We do complete family dentistry. I think one of the most important things we do is a complete evaluation of all of our patients. That includes the periodontal health. The #1 leading cause of tooth loss is periodontal disease. And so the most important thing is keeping the mouth healthy, the periodontal tissues healthy, and helping people be educated in how they can play a role in keeping their mouths healthy, their gums healthy, keeping their teeth for a lifetime. So one of the greatest benefits is keeping your mouth healthy, because in doing that, your general health, your overall health is improved, because there's many diseases that are linked to periodontal disease. So what we try and do is help people along those lines in keeping their mouth healthy.
Great. So what makes one a candidate for a gum grafting procedure?
So a lot of times what happens is the gum recedes. Your gums actually shrink down over time, and that can be caused by calculus built up under the gums. When the calculus is built up under the gums, the bacteria count increases under the gums, and as the bacteria increase, toxic products are formed, and those toxic products attack the bone. When the bone is attacked, the bone shrinks away, and as a result of that, the gums recede, and there's less gum and bone to support the tooth. So a tooth, you can lose attachment. We call this attachment loss. When you lose attachment, then the tooth can become loose and be subject to being lost. So the important thing is to prevent that calculus buildup, prevent malocclusions when the occlusion is not right, because the teeth are not set there properly. We can improve that orthodontically, but without doing that, you can put forces on those teeth that can cause also teeth to be lost. In addition, there's genetic factors in periodontal disease that it's a genetic problem that runs in the family. So those people that have genetic or pre-genetically disposed to periodontal disease need to be especially vigilant.
So if we are talking about preventative measures, we're talking about flossing and regular cleanings to prevent that calcium buildup. Is that correct?
Right. The main thing is we want to, evaluate. Everybody's a little bit different. Some people tend to build up calculus much more frequently than other people, so they may need to have their teeth cleaned more frequently than somebody else. So there's the individual variation there. But when the gum recedes, sometimes you need to restore that lost attachment, and you can do that with a graft. You can actually take tissue from that patient and then transplant it to the area in need to restore the lost gingival contours, making the gingiva more hardy or healthful, and that prevents the gums from receding. So, so that will help prevent tooth loss. An excellent question, Jeremy.
Yeah, and so where does the tissue come from?
There's some sources where you can actually take that tissue from a tissue bank, and you can also get that tissue right from the patient there, and just use, that's probably the best tissue, is to take it from the individual who's lost gum. You can take that from maybe the inside of their mouth on the top. You can take some tissue from there, transplant it to the area in need, and put a few stitches in to hold it in place, and then the gum will regenerate where you took it from that area, the recipient site. It'll grow right back to where it was normal, and then that transplanted tissue will actually restore the contours like more closely to what they used to be. Sometimes you can't do it all of that, but you certainly can make the gingiva thicker and healthier and less subject to further loss or attachment loss, which will jeopardize maintaining that particular tooth or teeth in the mouth.
And how long does a procedure typically take?
It's usually about an hour to do that, Jeremy, depending on how many teeth they're doing.
Oh, wow. Okay.
It could take, a little less. It could take a little bit longer.
And cosmetically, how does it look when it's done?
It improves the cosmetics because you have less of that long tooth syndrome, and you have more of the natural contours, the beautiful contours. So when you smile, you don't have a tooth that's super long there. So when I smile, you see just the normal contours or the length of the teeth. There's not excessive tooth showing because there's not attachment loss.
Okay, well, that's good to know. I think just so for our viewers, once again, if you are considering a periodontal procedure, a gum graft, or you think you may need one, or you're having some issues, pick up the phone, give Dr. Carlson a call. He's certainly worth having a consultation with. And his number, once again, is 425-775-2521. You can also visit his website, and that is www.rwcarlsondds.com. So once again, Dr. Carlson, thank you so much for being on the air with us today, and I look forward to speaking with you on further topics down the road.
Thank you, Jeremy. Thank you for having us.
You're welcome. Take care.
All right, bye.
Okay, bye.